All right, so because of our vacation last week, it's been almost 2 full weeks since we did our last COVID update: cases, hospitalizations, deaths, vaccinations. And I think while there's still caution, I would characterize today's report as good news compared to what we were seeing 2 weeks ago. It did look for a little bit there a couple of weeks ago like we might be seeing a pretty bad turnaround with cases first leveling off and even climbing slightly for about 7 to 10 days. And there were concerns about, are we heading towards a fourth wave or a fourth spike? That uptick in cases has now reversed. In some states, they're still spiking, and we'll talk about why. But the cases are coming back down. Deaths continue down. Vaccinations have dramatically accelerated. And I believe, after looking at the data, talking to a few doctors yesterday and today, and just looking at what Dr. Fauci said recently as well, I believe we are on the path to a very good situation by Memorial Day, which is May 31st, the last day of May, right around 8 weeks from today. So let's dig right into the data. Cases, you might recall, peaked at 256,000 a day back in mid-January and started to decline, bottoming out in the middle of March around 55,000 per day. But by the time our break started, the cases had actually trickled back up to about 68,000 a day, up from 55K to 68K. And that's when the fourth wave discussion started. The cause of that uptick appears to be a combination of unvaccinated people going wild. If you look at, for example, who's getting the virus lately, it is more and more younger people getting the virus, not yet vaccinated, but acting as if we've reached herd immunity, combined with a more contagious British variant, which is essentially dominant in some places. Michigan is one place where we've seen a lot of that. The Northeast is another place. It appears as though we may not be on the way up because, again, cases are starting to decline from that 68K pop down to about 64. Now, that's a small change. It's not totally obvious that we're on the way back down, but at least we're not continuing to see an increase. And if vaccination continues to accelerate, we should see substantial case declines over the next 8 weeks. And I'll tell you why a little bit later. In terms of deaths, the strategy of vaccinating the most likely to die if they get the virus, after doing healthcare workers, of course, is working, even as cases leveled out. And we said, well, deaths are on a 3-week delay from cases. We may see deaths level out. They didn't. Deaths have continued down the entire time. You might remember they peaked at nearly 3,500 per day, more than a 9/11 a day in January. They went below 3,000 a day in the first week of February, below 2,000 a day around February 20th, below 1,000 a day in that fourth week of March, and now down to just a hair over 800 deaths a day. Still horrifying, still a tragic number, but one that is now down about 77% from its peak in late January. This should continue because, cases aside, even against the variants, the vaccines are nearly 100% effective at preventing death. Vaccination. Over the weekend, the U.S. had consecutive days with 4 million vaccines per day. We are now averaging just over 3 million doses per day. This means that every day, roughly 1% of the U.S. population is getting a shot. Now, it's not 1% is being fully vaccinated each day. A lot of those are 2-dose regimens. So still, 1% of the U.S. population is now getting a shot every day. The reason we know this will pay off in about 6 to 8 weeks is we look at Israeli data. Israel has now vaccinated more than 55% of its population. They are basically wide open. Passover was almost a completely normal Passover with gatherings and everything. And cases and hospitalizations, serious COVID deaths are all down dramatically. We have the chart up on the screen for our video audience. It looks very, very good. Now, then we get to, but, David, what about those variants? Yeah, the variants are concerning. 8, 9, 10 months from now, maybe even 6 to 8, we may be seeing new booster vaccines dialed in for these variants. The current vaccines work pretty well against the variants. They work less well, but they work pretty well. And they are almost as effective at preventing serious COVID and death in almost every case. Here's a graphic from Dr. Eric Topol, who we've interviewed on the program. I highly recommend following him on Twitter about the variants. Against the UK variant, a very modest reduction in vaccine efficacy. Against the South African variant, a little more reduction. We don't yet have real world data about the Brazilian variant, but that's the least prevalent variant in the US. And in vitro studies, serum studies show that the vaccines still work against the Brazilian variant. But we do have to keep vaccinating faster. It's a race. What will we do? What will happen faster? These variants becoming predominant or vaccination? Israel is predominantly the British variant. And they are, as I showed you, completely dominating this. Joe Biden today expected to announce another major advance in full vaccination eligibility. Remember, Joe Biden about a month ago said, May 1st, I want every state making everybody eligible. Today, and it may happen before you listen to today's show, Joe Biden expected to announce that he's moving that up by a couple of weeks. April 19th now, there will be full vaccine eligibility. All good news, going in the right direction. Let's keep going. Many so-called healthy snacks don't taste that great. They don't fill you up. They don't satisfy a craving, which is why you should check out our sponsor, Monk Pack, and their keto nut and seed bars. Delicious sweet snacks with only a gram of sugar or less, 2 to 3 grams of net carbs, and just 150 calories. Perfect for the keto or low carb diet, or anybody who just generally tries to eat a low sugar diet like me. I love the Monk Pack keto nut and seed bars. Just a great balance of sweet and salty, soft and chewy, but with a nice crunch from the nuts and seeds. You can get great flavors like caramel, not caramel. Come on, guys. Caramel sea salt dark chocolate, peanut butter dark chocolate. That's my personal favorite. They'll give you all of your money back if you don't love it. Go to monkpack.com. The link is down below, and you'll get 20% off any of their products when you use the coupon code Pakman.